Let me say something most men will never admit out loud. You have been touching her wrong for years, possibly decades, and she has never told you. Not because she does not care, because she would rather protect your confidence than bruise it with the truth. Somewhere along the way, she quietly accepted that this part of your intimacy was just fine, adequate, something she endured rather than craved. That quiet acceptance is the most heartbreaking thing I encounter in my work with couples. Because here is what I know after 12 years of practicing urology. The gap between what most men do and what actually drives a woman to overwhelming pleasure is not talent. It is not youth. It is not some genetic gift. It is knowledge, specific, biological, evidence-based knowledge about how a woman's body actually works, knowledge nobody ever gave you, until right now. My name is Dr. Nerita. I am a board-certified urologist with full surgical and clinical training, specializing in the male and female urinary and reproductive systems. I have studied nerve pathways, vascular response, and hormonal interaction for over 12 years of active clinical practice. In those 12 years, I have worked with thousands of men and many couples who came to me with a quiet, painful admission. Their intimate life had become distant, mechanical, a shadow of what it once was. What I discovered consistently was this: these men were not struggling because of age or biology. They were struggling because they had never been given accurate information about how a woman's body responds to touch. I am here to change that, with precision, with respect, and with the same directness I bring to every conversation inside my clinic. This is not entertainment, this is education, and it has the power to transform your relationship in ways that go far deeper than the bedroom. If you have ever wondered whether she is truly satisfied or just being kind-hit like right now, you are not alone in that question. Drop a comment and tell me where in the world you are watching from. I read every single one. And if you are new here, please subscribe, because every week I bring you honest, science-backed conversations about men's health and relationships that nobody else is willing to have. Now, 9 tips. Treat them not as tricks, but as a new language your hands can learn to speak. Before tip number 1, I need to dismantle a myth sitting at the root of most men's failures in this area. The myth that a woman's breasts are primarily visual, that the touch itself is more symbolic than functional. This is anatomically, neurologically, and emotionally false. The breast, specifically the nipple and surrounding areola, contains one of the densest concentrations of sensory nerve endings in the entire female body. When stimulated correctly, those nerve endings send signals directly to the same region of the brain that processes genital sensation. For a significant percentage of women, breast stimulation alone can produce genuine, full-body climax. But even beyond that, skilled touch in this area triggers oxytocin, the bonding hormone, which lowers cortisol, relaxes the pelvic floor, and shifts her entire nervous system from guarded to receptive. When you get this right, you are not just touching her body, you are chemically and neurologically preparing her for a level of pleasure that rushed, careless touch will never access. Tip number 1, consent and genuine curiosity. Ask her, not apologetically, with genuine, confident curiosity. Something as simple as, tell me what feels good to you. Do you prefer lighter touch or firmer? Are there places that are more sensitive than others? That one question asked calmly, with real interest, does something remarkable before you have touched her at all. It signals safety. It tells her that her experience is the priority, not your performance. And when a woman feels safe, her nervous system shifts, cortisol drops, oxytocin begins to rise. I had a patient, a 61-year-old man, married for over 30 years, who came to me because his wife had grown increasingly distant in their intimate life. In 3 decades of marriage, he had never once asked her what she liked. He had guessed, repeated the same patterns, assuming her silence meant satisfaction. It did not. When he started asking, just asking, one simple question, she told me it was the most connected she had felt to him in years. Before anything else changed, before any technique was applied, ask her. It is the most powerful thing you will do tonight. Tip number 2, start wide, arrive slowly. Most men move directly to the breast within the first moments of intimacy. They treat it as a destination rather than a journey, and in doing so, they skip the neurological preparation that makes the destination worth arriving at. Begin at the edges, warm hands tracing the collarbone, light fingertips along the upper chest, slow strokes along the outer curve of the rib cage, the warmth of your breath at her neck. What you are doing biologically is activating the parasympathetic nervous system, shifting her body out of everyday tension and into genuine receptivity. By the time your touch arrives at its destination, she is already responding, already open, already halfway there. A small amount of fragrance-free, skin-safe lubricant applied to your hands eliminates friction and allows your touch to glide in a way no dry hand can replicate. Go wide. Arrive slowly. Let anticipation do half the work. Tip number 3, hold with intention. Most men grip. They squeeze with fingers, apply pressure the way they would hold something they are trying to keep. Every one of those instincts is wrong. What her body responds to is cradling, using the full palm, supporting the natural weight with your whole hand rather than grasping with your fingers, alternating between gentle, intentional compression and moments of complete stillness where you are simply present. The nerve endings in breast tissue respond most powerfully not to pressure but to variation, the contrast between movement and stillness, warmth, and the slight coolness of released contact. Watch her responses. Her breathing will change when something feels right. It deepens, slows, becomes less controlled. She may lean into your hand. These signals are unmistakable when you know what to look for, and they are your guide for everything that follows. Tip number 4, the areola is not a detour. Almost every man fixates on the nipple as the endpoint, the target, and in doing so, he bypasses a region of tissue that is, for many women, even more sensitive. The areola, the darker, textured circle surrounding the nipple, is densely innervated with nerve endings that respond to light, circular, teasing stimulation in ways the nipple alone cannot replicate. When you trace slow, gentle spirals around the outer edge of the areola, moving gradually inward but never quite arriving at the nipple, you are creating neurological anticipation, a building, almost unbearable awareness that makes the eventual touch of the nipple feel like electricity rather than just pressure. Use the very tip of one finger. Move as slowly as you can make yourself move. Resist the urge to rush to the center. The teasing is not foreplay for the real thing. The teasing is the real thing. Tip number 5, the dimmer switch principle. Think of a dimmer switch, not a light switch, a dimmer. You do not go from darkness to full brightness in one movement. You rotate slowly, watching the room change as you go. This is exactly how you approach the nipple. Begin with the lightest possible contact breath before fingers, featherweight touch before any pressure at all. As her responses invite more, increase very slightly. A gentle rolling motion between the pad of your thumb and the side of your index finger. A soft press and release. What you are building is a neurological crescendo. Each small increase in stimulation is processed against the baseline of what came before, and the contrast is what creates intensity. Never pull sharply. Never apply abrupt, unannounced pressure. A small amount of lubricant on your fingertips at this stage eliminates any roughness that might interrupt what you are building. Trust the dimmer. It works. Tip number 6, your mouth is an instrument. Your mouth is capable of a quality of warmth, moisture, and graduated pressure that no hand can replicate. Begin with breath alone. Warm, slow breath directed at the skin you have already warmed with your hands. Then lips slow, unhurried, no pressure. Tracing the same circular path around the areola that your fingers mapped. Gentle suction, building only as her responses invite more. If you choose to introduce the lightest grazing of teeth, test the pressure first on your own forearm. This is not an affectation, it is precision. The forearm gives you accurate feedback before you apply it somewhere that matters. And always, always watch her face as much as her body. Her face tells you the truth even when her voice says nothing. Tip number 7, words and breath as amplifiers. Your voice, used correctly, is a sensory amplifier. Quiet, genuine words spoken close to her skin change the entire emotional temperature of what you are doing, not rehearsed compliments. Real, present, specific observations, what you notice, what you feel, what she means to you in this moment. And then there is breath, your breath, synchronized with hers. When you slow your exhale and make it audible, she begins to mirror it. Her nervous system responds to the cue of calm, and that physiological shift creates the neurological conditions for pleasure to deepen and expand. You are not just touching her body, you are breathing together, and that shared rhythm is one of the most intimate things two people can do. Tip number 8, pairing and layering. When breast stimulation is layered alongside consistent, focused attention elsewhere, the overall intensity of arousal amplifies significantly. The brain processes multiple simultaneous pleasure signals, and the cumulative effect is greater than the sum of its parts. The critical principle: change only one variable at a time. If you shift what your hand is doing, keep everything else constant. Her nervous system needs time to track and lock onto each sensation. When too many things change simultaneously, the arousal dissipates rather than builds. Patience here is not restraint. Patience here is skill. Tip number 9, temperature, contrast, and only with full enthusiasm. Temperature, contrast, warmth, followed by coolness applied to sensitized skin can dramatically heighten nerve response. A warm palm followed by cooled fingertips, the warmth of your breath followed by a brief moment of cooler air. The nervous system processes these contrasts as novelty, and novelty heightens attention and therefore sensation. If you explore any tools or devices together, begin at the absolute lowest intensity and remove anything immediately at the first sign of discomfort or unusual sensitivity. Skip this tip entirely if there is any pregnancy, injury, or medical concern in play. This tip is last for a reason. Everything before it is the foundation. This is the final room in a house that has to be built correctly first. Now let us dive into the practical framework I want you to follow. Start with a genuine question before you touch anything. Build gradually from the outside in. Use your whole hand to cradle, not your fingers to grip. Trace the areola before the nipple, slowly and with deliberate teasing. Build intensity like a dimmer switch incrementally, responding to her. Add your mouth with warmth and patience if she welcomes it. Let your voice and your breath become part of the experience. Layer sensations strategically, changing one variable at a time. And for couples ready to explore further temperature and tools, only with full, enthusiastic mutual openness. When it is over, do not leave. Stay. Hold her. Let your breathing settle together. Many women will tell you honestly that this moment, the stillness after being held, is the most important part of the entire experience. I want to speak directly to the men watching this and feeling a complicated mix of things right now. Perhaps recognition, perhaps regret about years of not knowing what you did not know. There is no shame in this. Nobody gave you this information. You did not fail. You were not taught. The men I have watched transform their intimate relationships were not young men. They were men in their 50s, 60s, and 70s who decided it was not too late to learn something new. Every single one of them told me the same thing, that the intimacy they found on the other side of that learning was deeper than anything they had known before. That is available to you, right now. Maturity does not diminish intimacy. If anything, it refines it. The patience you have built over decades, the genuine love you carry, these are gifts younger men do not possess. Start with tip number 1. Tonight, just the question, just genuine curiosity, and let everything else follow. If this helped you, hit like, subscribe, and share it with a man in your life who needs to hear it. Which of these 9 tips surprised you most? Drop it in the comments. I read every single one. I am Dr. Nerita, your urologist,